Hey, future PTAs. Hope you guys are doing well, making it through these lectures. So this is chapter 3. This is the last chapter we're covering in this lecture. I'll go to full screen. Okay, here we go. And we're talking about inflammation and tissue repair. There's our outline. Hold it on there for a second so at least you can see it. So our roles of rehab professional in managing inflammation and healing. So we treat the inflammatory condition resulting from trauma, surgery, or some type of problem healing. Some of the things that we do to help treat inflammation are modalities, exercises, manual techniques, and really others as well. There are 4 phases of inflammation that we will go into further. The inflammatory phase, which prepares the wound for healing, that's initially when an injury occurs, up to like 6 days. The proliferation stage, which rebuilds the damaged structures, strengthens the wound, that starts around day 3 and continues usually till about day 20. The maturation phase, where the scar tissue is maturing and modifying, usually that starts around day 9 and continues even for sometimes years after an injury or damage. If you notice, the phases overlap and the duration really depends on the person. The younger somebody is, the faster they're going to heal. The older and maybe less healthy or more comorbidities, the slower they're going to heal. So there's a lot that goes into healing. So we're going to go further into the inflammatory phase. Inflamer means to set on fire. So we're talking about heat, redness, swelling, pain, loss of function coming to the area during the inflammatory phase. It begins when normal physiology is altered. So either a injury like trauma or some type of disease changes what is normally occurring, and that starts the inflammatory phase. It's an attempt to destroy, dilute, or isolate the cells or agents that may be at fault, and it's a necessary part of healing. It can, however, become inappropriate, such as with an autoimmune disease or with chronic inflammation, and it could cause more tissue damage and excessive scarring. The thing about inflammation is it has like an on switch and not an off switch oftentimes. So it's like, come on, guys, keep it moving. Come to the area. Send all the troops here. Help us fight this trauma or this disease or this injury. And then it just keeps saying, keep them coming, keep them coming. And then sometimes the inflammation itself becomes damaging and becomes what's causing more pain and less movement. Our blood, remember, flows from a higher pressure to a lower pressure. It kind of naturally goes through a gradient and is pushed out through the capillaries to areas of lower pressure. And when there's swelling in an area, it's good because the blood brings more nutrients, but as it pools in that area, the pressure goes up, which causes new blood to be less likely to come in. So nutrients are being delivered even less, and then the toxins are staying in because the movement, the flow is disrupted. Okay, does that make sense? So once the inflammation comes and just gathers there and stays there, it can become a problem of getting more nutrients in and the toxins out, which happens with your normal blood flow as the exchange happens. So it can become an issue. So continuing on with other components of the inflammatory phase, the next several slides will discuss the different components. The vascular response is our swelling and our redness. It brings histamines, kinins, prostaglandins all to the area. The right after an injury, during the first few minutes, 5 to 10 minutes, there is a vasoconstriction where the blood vessels get smaller in an attempt to decrease the amount of blood that's lost. And then after that, there's vasodilation where the blood vessels expand in order to bring more blood and nutrients to the area to promote healing. The hemostatic response, that controls the blood loss when the vessels are damaged. Platelets come and try and aggregate together to form a clot and stop the bleeding. A lattice, or like a um, like this. A pattern is formed to also help prevent the blood loss and provide some type of strength to the damaged tissue. The cellular response, leukocytes migrate to the area in order to clear out debris and set the stage for tissue repair. Phagocytes come. Phagocytes macrophage or eat the tissues to remove the damaged tissues, and a byproduct of them eating the debris and things, they release certain substances like hydrogen peroxide, ascorbic acid, lactic acid, which all kill harmful microorganisms. So it's a great thing for this to happen and decrease your risk of infection. The immune response, it activates neutrophils and other infection-fighting agents to also help keep from you getting an infection. And then fibroblasts are recruited to stimulate cell division, and that kind of sets the stage for the next stage, which is proliferation. During proliferation, the purpose is to cover the wound and strengthen the injury site. There are 4 phases that happen all at the same time, and that's epithelialization, collagen production, wound contraction, and neovascularization. So with epithelialization, you're trying to reestablish the epidermis, that top layer of skin. This can protect the wound, prevent fluid and electrolyte loss, decrease the risk of infection. But what is really interesting is that this epithelialization stage is promoted by there being a gap there. So when, I'm going to exit the full screen for a second, when the cells don't feel another cell touching them, then a thing occurs, which is called, my thing is blocking it, contact inhibition. So when 2 cells touch, they're like, oh, we're all here, we're good, and contact inhibition occurs. But when they're not touching, they're like, wait, I don't feel my friends around me. I need to stimulate more growth to get closer until I touch. So once you approximate a wound, like by stitching it up and bringing it together, closing it, it actually decreases the epithelialization because they're touching each other, and so they don't have that stimulation to produce more cells. So hopefully that makes sense. If it doesn't, just ask me in class exactly what that means. So although when you stitch up a wound, it does allow the wound to heal faster by going ahead and approximating it for you, bringing the tissues together, and it keeps the bacteria and things out, so it's less likely to get infected when it's closed up, as long as there wasn't bacteria in it when it was closed. And it usually doesn't scar as badly when you approximate the wound. However, it decreases the speed of this stage because the tissues are already touching, and so they're saying, we don't really need to do that much work right now. We're good. And so it lowers the process. Collagen production's happening at the same time. The interesting thing about collagen is when it's first produced, it's just thrown down haphazardly. That's why I have that picture of the leaves here, is it is just thrown down any old way. It is not organized. It is not lined up to be useful tissue. It's just thrown down to start creating tissue structures there to be used. So fibroblasts are what form the collagen. Cross fibers increase the strength of the tissues. During the collagen production, tissues with fibroblasts, new capillaries, and myofibroblasts form what we call granulation tissue, which tells you that there's healthy tissue creating new tissue there. Initially, type 3 collagen is what's laid down. That's laid down haphazardly, like I said, and eventually it's replaced by mature tissue, or by type 1 tissue, which is more strong and which is aligned more in an organized manner to be useful. So the more that you move the tissue as it's healing and maturing, the more it gets an idea of how the normal alignment of that tissue is, and the more the collagen realigns itself to match the tissue that it's replacing. But if you don't move it at all, then it does not know how to realign to match the tissue, and it's more likely to get kind of fixed and stuck and cause a contracture and not move very well. The problem though is as you're moving weak tissues, it's also more likely to get injured. So it's kind of constantly this balancing game of I need to move the tissue enough to realign the collagen fibers to match the ones surrounding them so it's more useful and can move like the tissue it's replacing, but I need to not move it so much that it causes more inflammation and damage and possibly re-injury of the area. So there's kind of a fine line we have to walk between moving the tissues enough to realign the collagen correctly and not enough to injure. Wound contraction also occurs during this stage. It pulls the edges of the injury back together. So myofibroblasts, which have the same properties as smooth muscle, attract to the borders to pull the epithelial layers together. If this step is uncontrolled, then a contracture will form. So there are different things that can pull the wound together. So primary intention is what happens when you take it and you pull it and you stitch it together. So stitches would be primary intention. They take it and they approximate the tissues and then they sew them together so that they are already together. Secondary intention is when a wound heals by pulling itself together. So it just creates more and more skin and pulls together. If it becomes out of control, it could pull together too forcefully and cause kind of like dimpling and pulling in of the surrounding skin, which could cause either a contracture or decreased movement. If it's too big of a wound and it can't pull it all the way together, sometimes a skin graft might be placed in the area, which would still be healing through primary intention, but we would call that delayed primary intention because the primary intention was not enough to heal it completely. So you need to do that pretty quickly after a wound begins the healing process in order to avoid contractures, or else it might pull the edges in too much and kind of pucker the area and cause decreased movement. Neurovascularization. So when new blood vessels form, that's called angiogenesis. They bring oxygen, they bring nutrients to the area to promote more healing. In this stage, the capillaries are immature and weak and likely to be injured with movement. So again, we have to be really careful because too much movement causes injury and just breaks up this whole process of new collagen and new skin being made and developed and laid down and reorganized. But not enough movement also delays the process and can cause it to be organized and matured in a way that's not useful. So we have to really kind of play that game. The maturation phase is next. So that's the longest stage in tissue healing. It can even last a year or two after an injury. This restores the function of the injured tissue to its prior function. There is a balance between the lysis or breaking down of collagen and the synthesis or making of new collagen that is needed in order for a good scar remodeling to happen. So if too much collagen is being produced and not enough is being broken down, then a keloid or a hypertrophic scar can result, and it can be a little less mobile and a little more noticeable. But if not enough collagen is being produced, then the scar does not get strengthened and heal properly. It could crack open and not have a good healing process. Oxygen is needed for collagen to be produced. So if you know that you have a problem with keloids or if it's a really big area or something, a little bit of pressure on that area in order to decrease the oxygen to those tissues is helpful. That's why pressure garments are worn to decrease the oxygen and decrease the likelihood of you getting a keloid scar in that area. Again, in this stage, the type 3 collagen replaces the type 1. This is a stronger collagen. I'm sorry, it is replaced by the type 1. The type 3 collagen that was placed down initially is replaced by the type 1. It's stronger, it's more organized, it's more like the tissue it's replacing, and it's more functional. Chronic inflammation happens. So there's 3 phases. There's acute, which is in the first 2 weeks. There's subacute, which is around 2 to 4 weeks, maybe a little bit longer. And then there's chronic, which could last months. It could even last years. Why do we have chronic inflammation? Well, either we continue to injure the area. So, like, let's say you sprain your ankle, you continue to play your sport the whole season, and every time you go out and run on that ankle, it stirs up the inflammation, it creates more damage, and it causes eventually chronic inflammation, which is kind of a on switch that has trouble turning off again. Or it could be that the normal healing process has been interrupted either by a disease process like an autoimmune disease or something going wrong in the healing process and the body not responding like it should. Chronic inflammation causes increased scars and adhesions, scar tissue that causes decreased movement, decreased function, and reduced strength of the tissue that's healing. Some of the factors that affect the healing process are local, external, and systemic factors, which we will go through. Local factors are the type, size, and location of the injury. Infections are what accounts for about 50% of complications with wound healing, so it's really important to keep it clean and covered when possible. The vascular supply to the area also is a local factor that determines whether it's going to heal or not. Some of the external factors include modalities. So anything that we use externally to promote healing would be an external factor to healing. Again, the movement is really important. Too much early movement could delay healing. Not enough movement could cause contractures. So we really have to balance that out. A CPM machine, or continuous passive motion, is really key. So like in an ACL surgery, put on that CPM, it just takes it through a controlled, slow range of motion that allows for some normal movement without being harmful to the fragile tissue. So you immobilize the area when you're not in that machine to keep the tissues from being damaged, but then the machine moves it enough to reorganize the collagen appropriately. Some systemic factors that affect healing is your age. The younger you are, the faster you heal. The older you are, the slower you heal. Disease processes like diabetes or anything, any type of blood disorder or impairment could slow down the healing process. Certain medications speed up healing. Some of them slow down the healing depending on what they're doing to your body. And nutrition. Nutrition is our fuel for healing. Getting good vitamins and water and all the good nutrients helps heal, but there are certain foods that stir up inflammation and could actually slow down the healing process. So you have to kind of find that balance as well. So there are different tissues heal in different ways. It's important. There are important determinant of how the tissue heals. Some of those determinants are their capacity to regenerate, their vascular supply, and how damaged they are. So cartilage is poorly vascularized and have harder time healing. Tendons and ligaments have various vascularization, so they tend to heal in different ways. And then skeletal muscle and bone are well vascularized, so they have good blood supply, which helps them heal a little bit better. So cartilage has a limited ability to heal based on its low blood supply. It doesn't have very many lymphatic vessels near the cartilage, low blood supply, low nerves. However, if bone near the cartilage is damaged as well, sometimes it can kind of steal from their inflammatory process and use those cells to repair a little bit better. Tendons and ligament, their ability to repair depends on what type of tissue, like whether it's a tendon or ligament and where in the body it is, the extent of damage, their vascular supply, because each one has different depending on where it is in the body, and how long they're immobilized. Tendons actually have a unique scar maturation phase that actually helps them achieve a state that's close to normal, like normal strength and regeneration. It's important to do some controlled loading of ligaments to promote their healing and promote the strength as they heal. Skeletal muscle just depends on the trauma and how they're healed, and it can occur through stem cell proliferation and differentiation. However, if there's a really bad damage to the area, sometimes a calcification can create like it's called myositis ossificans, like a bone fragment in the muscle, which is hard to break up and can cause pain and decreased strength and function. Bone has 4 stages of healing. The first is the inflammatory stage, which happens right after impact. This creates a hematoma. It disrupts the blood supply. It lowers the pH. Then in the next stage, a soft callus starts to form. That's once the swelling goes down. This helps stabilize the fracture and decrease the pain. It reduces the chance of a fat embolism occurring. This third stage is a hard callus forms. That's usually 3 weeks to 4 months after the injury. So that's how long it typically takes bones to heal. And then the bone remodeling occurs where it becomes harder and more like the bone that it's replaced. And that can take months to years to completely finish. So the next slide is just some case studies that we can go through in lab together. So hopefully you have a good idea of inflammation and of kind of a foundational knowledge of modalities, and we will talk more about this in lab and go over some case studies together.